what are things that we can actually add to our diets, right? When you think about food, what's nourishing to our bodies? And things that are nourishing for our heart and things that are nourishing for our brain are also nourishing for our sleep. And so some of the research actually shows berries, things that have high fiber actually can promote better quality sleep. Hummus, beans, making yourself a little charcuterie plate and maybe like high fiber crackers. Definitely avoiding things that have a lot of sugar because that can cause more arousals at night. If you want specific recommendations for food.
Hey everyone, welcome back to the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte, and today I am delighted to do a part 2 with Dr. Valerie Cacho all about sleep strategies to improve our sleep. So Valerie is an integrative sleep medicine specialist. Her interests and expertise include diagnosing and treating medical sleep disorders, women's sleep concerns, mind-body approaches to insomnia, self-compassion training, clinical hypnotherapy, and promoting sleep health and wellness. She's the president and founder of Sleep Life Med, which is a tele-sleep practice in Hawaii and California. And she's also the CEO of Sleephoria, which is a wellness brand founded on the belief that a well-rested woman has the energy, clarity, and drive to change the world. So thank you so much for coming back on the podcast. I'm really excited to dive into these strategies. I know that you prepared, so I'm just going to hand over the microphone and let you run with it.
Thanks so much, Dr. Morgan. And I'm so happy to be here to talk to your audience again. So common questions that I get in my practice are, okay, so now that we've done the sleep test and it doesn't show that I have sleep apnea, how can I get better sleep? And, these are typically the patients who have insomnia for, whatever reason. Sometimes it started in around when their kids were little. Now their kids are out of the house and they still have a hard time sleeping. Or sometimes, a lot of women can have just really stressful jobs and it can be really difficult to wind down our brains at night. And so a really common concern that I get is, doc, my mind just wants to keep going and going. And so I always encourage them to know that you're actually in charge of your thoughts. You're in charge of our brains. It doesn't seem like that sometimes because, if it seems like we're on the sort of the rat reel and we're sort of just spinning around and around. But some of the practices that I encourage patients and I actually do them with them. The first that I really enjoy is called the 4-7-8 breathing technique. And this is something that you can do right before bedtime if you wake up in the middle of the night and have a hard time settling down. And the science behind this is that when you're able to control your breath, you can control your mind. And at the same time, if you think about our autonomic nervous system, it has the stress response on one side, the sympathetic drive, and the relaxation response on the other side, or the parasympathetic drive, or the relaxation response. And the best way to flip between that stressful state to that relaxing state is actually to change your breathing. So any parents here, they have kids who are having a tantrum. I know my son just had one this morning. He's, breathing really, really fast, can barely catch his breath and, just counting down, right? Encourage him just to be calm as possible. And it starts with the breath. And so the 4-7-8 breathing technique was actually coined by Dr. Andrew Weil, who's one of the fathers of integrative medicine. And it's all in the name. So 4, inhale for 4 seconds. You hold your breath for 7, and then you slowly exhale for 8. And so the magic or the science is the more you can focus on holding your breath and slowly exhaling, that's what helps you go into that relaxation response. And it takes, less than 2 minutes to do. It's something that's available to all of us. Really no side effects. I would say if you're not used to breathing, certainly you can count faster than slower. But sometimes people feel lightheaded. So if that's the case, go ahead and stop. So you can check these out on YouTube or, Dr. Weil's site, but 4-7-8 breathing technique. You can do it actually 4 times and that's it. Sometimes, when my mind is racing and I have, think about doing this technique, sometimes I don't even get to the third or fourth breath. I'm already starting to yawn and I know that it's already working. So that's one of my favorite go-tos. If you're having a hard time either settling down at night or wake up in the night and have a hard time going back to sleep. Another one is called the 5 things you can see exercise. And this is something that I actually heard first on by Jay Shetty, who is a monk turned meditation teacher. And I think it was on his website or his book. And it was really cool. And I looked more into it. And basically, it goes into your 5 senses, right? And so when your mind is racing and racing, you really need to anchor it into something. Anchoring it into your breath can be beneficial. But sometimes folks who, they try the breathing exercise and they still can't settle down, what is something else that they can do? And so I talk about the 5 things that you can see exercise. And you can do it, I probably would say the first time to do it, maybe not do it when you're lying in bed and it's dark because you can't really see too many things because you're actually going to name 5 things that you can see. So if you are going to be in bed and it's dark, maybe imagine yourself on a really relaxing vacation. What are the 5 things that you could see when you were there? Maybe you're on the beach. What are 5 things that you can see on the beach? And the next step is, you count down 4. What are 4 things that you can actually feel? So if I'm at the beach, maybe I'm feeling the sand beneath my feet. Maybe I'm feeling the warmth of the sun. Maybe I'm feeling the wind going across my body. So those are some things. So 5 things that you can see, 4 things that you can feel, 3 things that you can hear, right? So, it's really hard to have a busy mind and then really focus, okay, now what am I actually hearing? 2 things that you can smell, and then 1 thing that you can taste. Yeah. And so if you do it at night, it can be tricky because the lights are off, but imagine yourself on a really relaxing vacation. But this is also a good practice to do during the daytime, right? Maybe after lunch break, step away from your computer, look outside the window, right? Just be really aware and mindful of your surroundings. That's something that I really like as well. And then also the next practice is journaling. I know a lot of people recommend journaling. A lot of therapists recommend it. I have specific journaling prompts for sleep. And really what the type of work that I do with my patients are really just trying to uncover some of the original programming with their sleep. Sometimes patients will come to me and say, doctor, I'm just a bad sleeper. And I'm like, well, what do you mean by that? No one's actually a bad sleeper. It's almost like if you said that you're bad at breathing, right? Or you're bad at eating, right? Because sleep is, as important as, drinking water, eating food. But I guess that's true because I think for me, our diet culture tells people they're bad at eating. But really, it's a natural process that's built within you. Are you bad at it? Maybe it looks different from your partner or from your kids or your friends, but it's something that maybe just needs to be fostered a little bit. And oftentimes when I hear this, it's sometimes people who are a little bit more of a night owl, where, they have a hard time settling down around 9 or 10 because their internal clock is really shifted and their true bedtime is around 3 or 4. So some of the journaling prompts that I encourage people to write are, what are your thoughts about sleep? And where did those thoughts come from? Like myself, right? My mom, got to be in bed and stay in bed, right? And I tell my kids that, don't get out of your bed, stay in your room. You got to stay asleep. You got to get X amount hours of sleep. And then we still have those same thoughts. I mean, definitely for adults, 7 to 9 hours is ideal, but some people can really function well on 6.5. But they have stuck in their mind that, I have to get that 8 hours. And if I'm not getting that 8 hours, I'm such a bad sleeper. Yeah. So examining your sleep programming, whose voice is that's actually talking to you at night. And then looking at some of the limiting thoughts about sleep. Sometimes people that I work with who have pretty severe insomnia, they feel like they need to take something to fall asleep. Whether it be medications or supplements. And when you take a look at like their sleep diaries, the amount of sleep that they're actually getting isn't very much, meaning if we probably stopped that medication or that supplement, it would probably be no different. And what I encourage people to think about is when you take a medication or a supplement, it creates a chemical reaction in your brain and your body, right? Ideally, it can slow down your brain waves, stimulate that parasympathetic response, but sometimes your brain is just so powerful, it overrides those chemical processes. So creating habits around breathing, around focusing on the different 5 senses, right? imagine or rewriting that programming, right? You think of your sleep as sort of like a movie that you're watching, but now you're the screenwriter, you're the producer. You can decide what the outcome is going to be. It doesn't have to be another night of, sort of poor sleep. Yeah. So those are some of the things that I like to talk about with some of my patients. Definitely there are more. I don't know if your audience is into like mindfulness meditation. I actually perform specific ones with my patients. There's a book called Mindfulness-Based Therapy for Insomnia. And one of the ones that I really love is the cloud metaphor. And so basically, we do some breathing, focus on your breath, right? Get you outside of your mind. A lot of people, when they think of meditation, they think they just have to clear their mind. And that's not really the way I think of meditation. It's more of observing your thoughts. And so this is a good one, because if you think of the cloud like your thoughts, I encourage them just to observe it. Imagine you're looking outside a window or you're outside at a park. And what do you see, right? I mean, we can't control the weather, right? Sometimes there's, thunderstorms off in the distance, or sometimes the sky is just clear blue. Or sometimes there's just huge, fluffy white clouds that just look so nice. But if you think of your thoughts sort of like the clouds, you're just watching them go by and you're not trying to judge it, right? I mean, sometimes we play with our kids, oh, that cloud looks like an elephant, or, maybe that's a flower, but, we're not saying that's a bad thought. You shouldn't think that thought, right? And so the whole part of mindfulness is, can we get to a place of non-judging? Because a lot of times for people who have a hard time sleeping, there's a lot of negative energy, right? We judge ourselves. I'm a bad sleeper. I should be asleep because it's 2 o'clock, it's 3 o'clock. And then when we have those thoughts, it stimulates, guess what? That sympathetic drive. And that can, again, keep us from sleeping. So a lot of the practices that I'm recommending are different ways to help slow down your brainwave. And, think of your brain as a muscle, right? The more we practice these exercises, the easier it gets. Just like the more you go to the gym and lift weights, right? Then you can move up to the higher weights. And then sometimes people will ask me, well, what's the best one to do? And just like with exercise, right? Well, what's the best exercise for you? The one that you'll do, right? So I sort of give them a whole laundry list of things, and, they get to decide, sometimes, maybe they want to go outside and actually stare at the clouds. Or maybe it's raining and they don't really want to do that. Yeah. So maybe they can just do like the 5 senses exercise. So those are things that I like to talk about with my patients as well. Body scans, I'm definitely big in body scans. There's something called the progressive muscle relaxation, and this has actually been used a lot for patients who have insomnia. What the progressive muscle relaxation is you tense up different parts of your body. It's honestly not my favorite, but it's one of the most evidence-based techniques. It's not my favorite because I feel like I'm tense baseline. And so when I'm going to sleep, I don't want to tense myself up even more. But the thought is, right, sleep is a passive process. It's not that active phase, right? And so sometimes I like talking like when people are trying to force themselves to sleep, it's like they're squeezing and squeezing, they're trying to do something. But sleep happens sort of when we let go. So imagine you start from your toes, you can start from your head, and it's like, okay, tense up your toes, curl your toes just for a couple seconds and then relax them. And then go to your ankles and then go to your shins and then see how far you can go, because maybe by the time you get to your back or your stomach, you've already been asleep. So yeah, progressive muscle relaxation. You can definitely go on YouTube to find specific videos about that. What I like a little bit better is the compassionate body scan meditation. Because going into, the type of patients that I work with, they have a lot of self-judgments, they have a lot of negative self-talk. And if we can learn to speak to ourselves kindly, bring in that self-compassion. And so what I have recorded, and it's on my YouTube, is a compassionate body scan. And it's from Kristen Neff's book. She's sort of the leader in self-compassion. And instead of tensing up different parts of our bodies, she invites someone to think about their toes, think about the bottom of their feet, think about their feet. And maybe just send your feet some gratitude, thanking your feet for all the places it's helped you walk to, right? All the places that you've been. And who would you be without your feet? And then going up to your knees. If you didn't have knees, right, you couldn't walk well, right? Because you would probably just stumble over, your knees need to be bending in a certain way in concert with the rest of your body to help you move. So this whole idea of the compassionate body scan, it's sending love and kindness to different parts of your body. And sometimes we get into a place where, maybe we have some arthritis, or we have some back pain, or we have some hip pain. And so if we get to that body part in the body scan and it's like, oh, my hip is a little bit achy. No, I don't want to send it any type of compassion. Well, can you send it some healing then? Can you be like, okay, hip, you've been through a lot, can you send it some warm, loving energy where, okay, maybe it's not treating you the best at this time, but at the same time, be there for your hip in a certain way. So like personify your body parts in different ways. Yeah. And part of it is too, is, just put your hand on your hip or on your shoulder or on your heart, right? If your kid was crying, you probably just wouldn't ignore them. I mean, hopefully you give them a nice warm hug. And part of this whole self-compassion body scan is, giving yourself some hug, touching the different parts of your body that don't feel well. And just that touch elicits, I think, those feelings of relaxation.
I like all those.
Yeah.
I'm so glad that we've extended this conversation because we do so much mindset work in our program related to weight loss and like limiting thoughts about your health and where did those come from? Why do you feel like you have to be a certain weight or look a certain way? And did that come from your mom? Did that come from your grandma? Did that come from a magazine cover? And it's like, so there's actually quite a bit more overlap than I realized in our approaches on mindfulness and journaling through some of the limiting thoughts. And I love that self-compassion screen because we're big advocates of gratitude and not just like the broad stroke gratitude. I'm grateful for my health. Well, how specific can we get, and I think sometimes if people, like you mentioned, they struggle with that negative self-talk and that self-judgment. And so a lot of times I'll say, okay, so you don't like how you look in the mirror. Like, that's fine. Tell me something you appreciate about your body and then go deep. Okay, I like my ears. Well, go deeper. I like the 3 bones that vibrate in my ears to let me hear things. And there's so many, that's really cool. And the other thing that I'm reading a book, it's about meditation. It's called, it's a little bit weird. It's a little woo-woo and not really woo-woo. And it's not weird. I come from a Christian background. And so it's called Awakening the Buddha Within. And I'm reading it to learn more about meditation.
Oh, okay.
And it's pretty good.
Yeah, I come from a Christian background as well. And I think when I first started learning about things like mindfulness, it's quite different. And, before we hopped on today, I was actually doing some self-journaling and looking up some Bible verses. And the way I like to think of it is that, God created our bodies, he created our brain, he created the parasympathetic nervous system and the autonomic nervous system, right? And so, and he even rested, right? He took time for himself and he took self-care. So I guess, the Bible doesn't specifically talk about breathing exercises, but
it doesn't.
He was in the desert for 30 days or 40 days by himself. Like, I'm sure he was slowing down his breathing as he was praying, right?
Yeah. And I think what I'm finding really helpful from this book is a little bit more applied spirituality. So I feel like there's a difference between, the faith and spirituality for sure, like and religion and all that stuff. And I feel like you learn a little bit more about meditation when you're studying like spirituality. And so that's what I was really reading this book for. And he really describes that, meditation is not just like sitting there like a monk in Tibet, doing chants and stuff like that. It's like, it's being mindful and aware of your surroundings and your thoughts.
Yeah,
and so I think, how you described that was very much in line with what I'm reading in this book right now. And I think it's a relief that we can practice quote unquote meditation, like anytime we're practicing being mindful.
Right.
And we can do that just by tapping into our breath.
Yeah.
So simple. So I think it's a much more approachable way to think about like meditation is, okay, mindfulness. Anyways, it was kind of.
No, I love that. And 2 things that popped up in my mind as you said that, and I'm glad you brought that up, Morgan, is because sometimes people feel like they don't have 5 minutes in their day to sit down and journal, even to look outside. And so can you be in a meditative state while you're doing the things that you normally already
Yeah.
do? And so actually now 3 things popped in my mind. Brushing your teeth, right? If you're brushing your teeth, who is with you while you're brushing your teeth, right? Definitely for me, it's not the most mindful activity because I'm trying to teach my 2-year-old son. I'm trying to, my daughter's like talking to me, and I'm trying to make sure that, last time I went to the dentist, I didn't get the front part of my teeth really well because I did that purple stain. But can you be meditative or be mindful when you're just brushing your teeth? Because that's something you're already doing. Can you just focus on what the toothpaste tastes like? I use an electric brush. Okay. Am I going to wait and make sure I get each face of my tooth clean?
Yep.
That's one to start with, because usually it's about 2 minutes or less.
Yep.
Another one is when you're washing the dishes. Can you just wash the dish, right? I mean, that's something we all do. I mean, I think I said it to one patient. He's like, well, I don't really wash my dishes. I just put them inside the dishwasher. But the same thing, as you're putting the dishes in the dishwasher, can you look at it, right? What color is this dish? Notice some of the food that's still there, right? Notice the clarity of your glass, right? Or maybe it's like a little bit an older glass, right? See the coloring on it. So that's another one. And then a third one that, patients or, I don't have time to do, these exercises, they sound great. Well, you take a shower, right?
Yeah.
When you take a shower, can you be really mindful? Meaning, can you just think about the shampoo, smell it, right? Bring in you do the 5 senses exercise, feel the water, feel the temperature of the water, right?
I think
And
so
those
often,
are different exercises too.
Yeah. I mean, so often our body is doing one thing, but our brain is doing something else. And that's what I'm really
yes,
digging
definitely.
into in my own life right now is I want to be present. Like I want to be fully mentally, spiritually, emotionally, physically present. And that is so much easier or so much easier said than done.
Yeah, no, definitely.
One thing that I read this book for, why I got this book was to learn more about detachment. And that might be an interesting conversation because if people are laying awake at night, it's usually because they're worried about something. They're thinking about something. It's probably not in their control completely. Maybe they're feeling guilty or bad about one of their actions, or they're experiencing self-doubt. And how many attachments do we carry that contribute to that internal dialogue and that worry? So what happens if we can release those attachments to other people or to expectations or to the vision that we have for our own future or how we thought the day should go or a meeting should go? Do you have any thoughts personally or professionally around kind of detachment and how that can help with sleep?
Yeah, definitely. As you were saying that, I like let out a big sigh because we carry a lot,
Yeah,
like
we do.
women working,
And
just imagine like having a plate and it's so full of things. And then, you try to put more things on it, I'm just like, oh, my daughter needs to do this activity or that activity. And it's like, does she really? So, I mean, when you think about it in terms of sleep, I always like to do computer analogies, right? So, can you clear the cache at the end of the day? And what does that look like for you? For me, it's writing things down, that paper thought, downloading all that information, getting it off of my brain, clearing the cache. Sometimes it's hard. Sometimes there's tabs that just, I don't know, it's a little bit glitchy and it doesn't want to close. Sometimes I think we just have a lot of tabs open as well. And I think it gets to the point where like you're talking about mindfulness, what's the meaning behind that? Having self-doubt, having fears, but where does that come from? What's the feeling behind that? I think self-compassion helps a lot with our anxieties, our fears, our worries. For me, when I did this exercise, when it was just taking a look at sort of a difficult experience, a challenging experience, but nothing so challenging where it was almost like completely depressing. It was basically a time of my life when I worked for a company, and there was a lot of things that I wanted to do to change, to improve, but it just wasn't in alignment with their vision.
Yeah,
and
I get it.
It was me just saying, no, they don't care like I do. Just like maybe I could talk to someone who's going to care as much. And then I just would get really frustrated and almost angry in this sense. But then when I did this exercise, and it's part of the mindful self-compassion workbook, which, I think is fantastic for everyone to do, it's taking a step back. Well, what's behind that anger? It's well, I really cared about the community. The way that I saw things, I just wanted everybody to have access to. And so when I figured out that behind my anger was just this point of, well, everybody should be able to have equality, right? Which at the end of the day, right, there's only one of me, and it was a big organization. But just understanding, well, where does this doubt come from? Where does this fear come from? What's the feeling behind that? What's the emotion behind that? It's usually love, care. Why do I want my daughter to be on all these activities where I'm going to have to drive her around and maybe, cut out some of my clinic time? Well, I want her to experience life to the fullest. I want her to, be exposed. I want her to find something that she will be, joyful, passionate about, because I love her. Right. And so then I think it melts away some of those, the attachments, knowing where it's coming from.
A good point.
I don't know if that answers your question, but that's just sort of how I see it. Yeah.
Totally. Yeah, I think that does. And so kind of I like to say, like, not stopping at the first thought, like,
I love that.
What's behind that thought, or what's behind that emotion?
Exactly.
And just for anyone who's listening, if you can just kind of pay attention to your thoughts and your communication during the day, how much of it is about, gossip, or talking about somebody else in a negative way, or yourself in a negative way, or complaining.
Right.
It's like, all of that is adding to your stress bucket and draining your personal power, and probably impacting your sleep if you're not sleeping well.
No,
so
that's
I think,
true.
This mindfulness training, it starts with ourselves. And then I think that self-compassion extends to our family and our community too. But I wanted to touch on that attachment, because for me, that's been a big piece in my sleep journey, is detaching myself from my own expectations of myself and others. So when the kid gets up crying in the night, I had the attachment of sleeping through the night. It's a good example. I had the attachment of my child listening to me when I asked him to sleep through the night, or getting up to change his own diaper. And so if I can release that attachment, all of those attachments to expectations, and just accept the situation that it is what it is. He needs me at this moment. I will serve him in this moment. And then I can go back to bed. Like that internal chatter just like drops when it's like,
just it's a way to melt it. And some of my patients, I bring it a step further in terms of, okay, if tonight is a bad night and I have a low level of energy, what can I actually accomplish? Because, right, sometimes it's like, oh, my son woke up 3 times last night. Maybe I got 6 hours of sleep and I really need 8. What can I do? And so I encourage my patients, have a list. Okay, if you have low energy, maybe I'm just going to do one thing, or maybe I'm not even I'm going to throw my list outside the window and I'm just going to breathe and do my work. Versus if I have like a decent night, maybe I got a little bit more sleep and I have a medium level of energy. Okay, maybe I can tackle 1 or 2 things. Or maybe if it was a fantastic night and my battery is completely full, okay, now I can get, the majority of things done. So I think it's part of that, okay, detaching, well, okay, I need X amount of sleep. And if I don't, like, it's that cognitive distortion where it's a little bit all or none thinking. And it's like, we can't control, right? Things that can happen. But at the same time, we can choose what our day can still look like. Your day is not going to be ruined because you got an hour less of sleep.
Right. Like releasing the attachment to the expectation of getting a certain amount of sleep, or how you're going to feel after that sleep. So I know we're just about out of time, because it's a little bit quicker one. Will you share some nutrition things for us with sleep? You mentioned some foods that we can incorporate to sleep better.
Yeah, it's one of my favorite topics. So a lot of times, a lot of what we see are things to avoid, right? Stop alcohol, stop caffeine, because that's just going to ruin your sleep. But what are things that we can actually add to our diets, right? When you think about food, what's nourishing to our bodies, and things that are nourishing for our heart and things that are nourishing for our brain are also nourishing for our sleep. And so some of the research actually shows berries, things that have high fiber actually can promote better quality sleep. Hummus, beans, making yourself a little charcuterie plate and maybe like high fiber crackers. Definitely avoiding things that have a lot of sugar, because that can cause more arousals at night. If you want specific recommendations for food, small studies showing eating 2 kiwis an hour before desired bedtime has actually helped people report better quality sleep. Another study for almonds, it was done in Iran in university students, over 400 university students, 10 almonds a night. And almonds have a high amount of magnesium, and magnesium can help with the GABA system to help you relax as well. Yeah, so some of these little things can certainly help. Another, I don't know if anyone's heard of this tart cherry juice. It's promoted to help with sleep and have some melatonin in it, especially as we get older, around age 55 to 60, we have less melatonin release. So they've actually done small studies where elderly folks above 55 drink 2 glasses of melatonin. 2 glasses of tart cherry juice, one in the morning, one in the evening. You don't have to drink it right before you go to bedtime because, hopefully they'll not keep you from waking up to go to the bathroom. They actually studied these folks in the lab and they slept 84 minutes longer than the folks who did it, which is really remarkable because some of the sleeping pills don't even work that great. On average, maybe 20 to 30 minutes. So tart cherry juice, if you like the taste, almonds, things with high fiber, berries, beans, right? So definitely avoid the milk and cookies unless it's, I guess, not high fiber in the cookies. They put a lot of chia seeds. Yeah.
Did you mention something about tryptophan, like some foods that are higher in tryptophan? Does that help too?
Yeah, definitely. So tryptophan is a building block to melatonin.
Yeah.
And so, we need those, particle, the proteins or amino acid, sorry. We need that amino acid to get into our body, and then that turns into melatonin. So, and a lot of time we think about tryptophan, we think of turkey, but dairy food, dairy has a lot of tryptophan in it as well. Yeah.
Good. Well, I really appreciate you taking a little bit more time today to share some of the sleep strategies. I know that you could talk about this for such a long time, and you're such a just a wealth of knowledge, and I appreciate your generosity of time. So I'm going to actually link up a couple of the resources that you mentioned in today's episode, like the book. I think there was a YouTube video of yours that you mentioned in the show notes for people to check out. But what's your website as well, in case they wanted to reach out to work with you or, just ask a question or anything?
Sure. So my website is www.sleephoria. So that's sleep and HORIA.com. And same on all social channels. So YouTube and Instagram are Sleephoria as well.
Awesome. Well, thank you so much, Dr. Cacho. I really appreciate your time. All right.
Happy to be back. Take care. Sleep well.
Thanks.